If your target market is seniors and or baby boomers, then stay with me because today we're going to get into the minds of those seniors and baby boomers. Hi, my name's Jeremy Smith, and over the last 15 years I've been an agent, a manager, owner-operator of an insurance brokerage, and for the last 6 or 7 years I've been a business coach, traveling the country helping agents and agency owners grow their practices. And today I'm going to try and help you grow yours. If you've been on YouTube before, then you know the game. Please hit subscribe and ring the bell. So really soon, we're going to get into the fun stuff, more of the meat and potatoes about what this training video series is really about. We're going to get into stuff like sales processes and marketing plans. But before we can talk about marketing and selling, I think it's really important that we take a minute and think about who we're selling and marketing to and get into the minds of those people. For most of us, our target market is seniors or baby boomers. But have you ever really stopped to think about why they're our target market? Have you ever really stopped to think about who those people are and how their minds work? Well, that's what this training's about, so let's get into it. So let's start with the why for a second. Why is the baby boomers, why are they our target market? So obviously, they're the largest sector of people in our entire country, and they have been for a long, long time. I mean, you can walk out your front door and in a matter of about 5 minutes, no matter where you live, probably find a prospective client. They're not in the accumulation stage anymore, and that's a big reason why we focus on them. They're in the protection stage. They've already built their wealth. Now they're looking to figure out how they can protect their wealth. You as a life and health insurance agent, you've got the answers to those solutions. They've got all the money. That's a good reason why we go to these people. They've got the money. Therefore, they can pay their premiums, which means your policies stay on the books, which means you are starting to build residual income. That's a big reason why we target baby boomers and seniors. A couple other reasons. One, they're available. You know, most of them aren't working anymore. They're retired, so they've got the time for you to come to their house and sit down with them. Working class people, working age people, that's a lot harder to get in front of them. So now let's jump into maybe a little bit more important part of who are these people? How do their minds work? I really believe that if you'll stop for a second and try and get into the psychology of who these people are, where they come from, and how their minds work, it can't do anything but help you when communicating with seniors and baby boomers. So, baby boomers are people that were born right after World War II. Okay? These are people that lived in an economic time that was really tough when they were born, but improved dramatically over their childhood. From 1940 to 1960, the gross domestic product doubled. Purchasing power went up 30%. 4 out of 5 people owned a car for the first time ever. 60% of the people owned their own home. A lot of growth in that period of time from 1940 to 1960. Now, socially, these people lived in a really interesting time. Socially, the world that our clients lived in from 1940 to 1960, it was turmoil. These people, they witnessed so much more than we have, I feel like. You know, they witnessed the rise and fall of JFK, RFK, MLK. They've seen cool stuff like the moon landing, but at the same time, lived through the Cuban Missile Crisis. So highs and lows all over the board. So that's the baby boomers. But if we're really going to analyze the baby boomers, then we've got to take a quick second and remember their parents and the times their parents were growing up in and living in. Their parents grew up in the Great Depression. And boy, did that impact how their parents made decisions going forward. So I want to stop for a second and talk about what do their parents and the baby boomers, what do they go to bed with at night worrying about? Okay? There's really about 4 areas that these people go to bed with and concerns they go to bed with every night. Number 1 is long-term care. 95% of the seniors out there do not have anything coverage-wise to protect them from a long-term care situation. Even though they know that it's probably the highest probability as far as a financial time bomb that awaits them. Early death. Most people, once again, they haven't planned for this. Again, somebody with a life and health insurance agent, you've got the answers to this problem. Running out of money is a big one. A high percentage of the people in the United States go to bed and they worry about, do they have enough? Is the money that they've accumulated in their life going to be enough to take them to their deathbed? The final thing they worry about all the time is their health care. You know, finding it, keeping it, the changes, the updates. These are concerns that these people are thinking about all the time. So because of who these baby boomers are, how they grew up, the fears that were circled around them while they were growing up, and then also their lack of education when it comes to retirement planning, all of those things can dramatically make them make illogical decisions. You ever sit in front of a client where you put a proposal out in front of them and in your mind it is a night and day, make sense deal, and they won't sign the application? You ever sit in front of somebody that you did a warm-up, spent all kinds of time building trust with them, but they won't give you information? Well, it's because of how they were raised. These people were raised over that period of time to not trust the government, to not trust the stock market, not trust the banks, not trust financial advisors, and, oh, by the way, sometimes not even trust insurance agents. They were built in a time where all those places failed them at some point or another. These people were made a promise by their government that the government was going to take care of them through programs like Social Security and Medicare and Medicaid. And listen, the baby boomer bubble is getting bigger and bigger. Those programs very well may be available to all of those people for the rest of their lives. But logic would tell you the government is going to be a lot less involved in some of those programs. For example, I can about guarantee you that the government is not going to be able to help our baby boomer bubble people when it comes to long-term care situations like they did with their parents. There's just not enough money in the pot. I'm sure I don't have to explain to you why these clients of ours have distrust with banks and financial companies after the 2008 crash. And even in our own business, there's hundreds of thousands of agents that have come chasing into our industry, chasing after that money. And these are people that, a lot of them, don't have proper training. They don't have an actual business plan for how to actually create clients, and in some cases don't have seniors' best interest at heart. All of that makes our job even harder. But with all that said, there is some good news. And the good news is this. There are a lot of smart people in our industry, and over the last 10 years and going forward have created some of the most innovative products ever seen by the insurance business. Heck, if I went back and took a time capsule back to 1990 and talked to a life and health insurance agent and I showed him some of the products that we have now at our dispersal, his head would spin off. Used to be, if you wanted a long-term care policy, then you had to buy an actual long-term care policy, huge, fully underwritten process that very likely actually got approved, and if it did, those policies, the premiums on them increased through the roof once they got older. Now there's policies out there and products out there that you can combo your long-term care problems with annuities or combo them with life insurance policies, some of which are even simplified issue, no underwriting. Man, these products, again, a 1990 agent would kill to have the products that we have at our dispersal now. Couple that with the fact that we're living longer, and what that means to you as the agent is that our residuals are going to stay on the books for a lot longer, and therefore equaling more money in your pocket for a lot longer duration. If you're in the life and health insurance business and your daily business deals with seniors and baby boomers, I hope today's information helps you get a little more insight into who these people are and how they think. I would strongly urge you to continue this research and learn about those people. It will only help you in your sales practices and processes. Please do me a favor and like and subscribe, and we look forward to seeing you here on our next video. Thank you.